Hi, I'm Dr. Pinkey Patel, the CEO and founder of Myri Health. Four babies are born every second, and with each birth, a mother is born too. Picture this, the dream, a blissful image of motherhood. Society paints a picture that the ultimate dream is forming a happy family. The reality, isolation and lack of support. No one tells you that you'll be operating on just 1 to 2 hours of sleep while navigating extreme highs and lows, all while ensuring another human thrives, often from your own body. It's time to bridge the gap in resources between the dream and the reality. And that's exactly what Myra is here to do. Next. 80% of deaths in pregnancy and postpartum are preventable. The reality for mothers is that their interactions with healthcare are infrequent, often leaving them facing unfavorable health outcomes. 53% of these preventable deaths occur after a mother walks out of the two hospital doors. The first and only postpartum visit is at 6 weeks after delivery, and only 40% will make it to this short 11-minute appointment. Next. I'm a mom. I also hold a doctorate, and I'm certified in pre- and postnatal fitness. I had such a challenging experience in maternal and postpartum care that I was compelled to create a solution that would support every mother after me. With over 50,000 in my own online communities, I have directly supported thousands of women in their journeys. This hands-on experience fueled my comprehensive research that I performed to ensure that my solutions aligned perfectly with the real struggles faced by mothers. Next. The Myri Health app began as a postpartum tool. It was developed with gynecologists and physical therapists. It offered new moms personalized physical therapy, preventative assessments, expert evidence-based articles, community, which all led to excellent clinical outcomes. But we recognized that to fully support mothers, we needed to start at the beginning of their journey, which is in pregnancy. Next. Now, Myri's intelligent technology predicts and prevents complications. It offers personalized care tailored to each pregnancy. By analyzing real-time data and trends, we can identify high-risk pregnancies, predict potential issues, and offer proactive recommendations to prevent preterm labor. Next. Our platform supports mothers by seamlessly integrating with blood pressure devices, glucose monitors, wearables, and apps to track real-time health data. We prioritize maternal well-being first, but we can also share these insights with healthcare providers to ensure timely interventions and support. Next. So in addition to directly supporting mothers, we recognize that there was a real gap in care that lies between healthcare stakeholders, like a payer, provider, a mother, a doula, community healthcare worker. And to bridge these gaps, we can facilitate care coordination and offer EHR integration when needed. By providing real-time data, increasing touch points, and enhancing the quality of care, we save time and we reduce costs for all the parties involved. Next. For example, our care coordination dashboard delivers real-time health tracking and personalized care plans, bridging patients and providers. This connectivity bridges the gaps in the current system, preventing mothers and babies from falling through the cracks. Next. Our data-driven approach has delivered transformative outcomes and it's improved key health metrics. Next. With over 350,000 users across 44 paying countries and generating 6 figures in revenue organically, our beta success laid that foundation for growth. Our direct-to-consumer experience built a strong brand identity, and it provided invaluable market insights. But to reach more moms, we've refined our business model to B2B, and now we have a robust pipeline. Next. Myri is already trusted by leading brands. We now have a 3-channel tiered process, and we have attracted health plans and public health initiatives. Next. Our multidisciplinary team combines deep healthcare and technology expertise, and we're guided by medical advisors and industry veterans. Next. We are supported by mission-aligned partners and are committed to ensuring the highest standards of data security and privacy, with being SOC 2 by the end of the year. Next. My ask of the HITLAB community is for introductions to additional pilot opportunities and payer partnerships. We're at a very pivotal stage in our business, and we are raising capital to support implementation and drive growth. If you want to check on the health of a community, check on the health of a mom. We are accessible, we are affordable, and we are essential. The world creates tech for the future. It's time we create tech for moms who birth the future. I look forward to meeting all of you in the networking sessions. Thank you.
Thank you, Pinkey. That's fantastic. And our first question is from Julianne.
Hi, you packed a lot in there, so there's so much to go for, but I'd love to understand a little bit more about your go-to-market for today and how that's looking and where you're focused.
Yeah, so our go-to-market today, we started with the employer engagement that led to enterprise contracts. So we did start with the self-insured employers that generated that data that I was talking about with clinical outcomes, which was very promising. Now we're at a position where we're in conversations and negotiating contracts with payers and also public health initiatives. So for example, with payers, it is a preventative model. They're looking at us from a few angles. It could be whether they're needing care coordination, or they might just be needing a platform like Myri to improve birthing outcomes. From a public health standpoint, we've done a lot of work in Kansas. We're about to initiate some work in nearing states. I'm in Oklahoma, in the rural communities. And so we had some promising clinical outcomes with the engagements that we had that were paid with these rural communities. And so with public health, it kind of goes parallel with how these, not just conversations, we're actually now about to implement additional care modeling for some of these communities. So it's primarily payer relationships and also public health. Yes.
Awesome. Thank you.
Great. And another question from our esteemed judges.
Hey, great job, Dr. Patel. Just wondering if you could give us a little bit more insight into your online community of 50,000. I think those are also the users of the platform. Can you cohort them for us? Or if it's not 50,000, whatever the number is, how do they behave on the platform? What do they find most useful? And what is that subpopulation where you're getting the best outcomes that are of interest to those B2B customers that you want?
Yeah, awesome. So the 50,000 was referring to actually my online community. I'm also an influencer. So I started the influencing. Honestly, this is kind of where the idea started organically, was talking about my experience in motherhood. So my background's actually in pharmacy. I worked for United Healthcare for 13 years, but I'm also a pre and postnatal trainer. I authentically shared my experience, which is where the idea came from. So I built a consultancy through social media, and that validated what the pain points were. And so whenever I launched this 3 weeks before delivering my son in beta, don't know if I always recommend that one, but it really garnered the 350,000 users that I mentioned initially. And so that allowed us to understand what did they like, what did they not like. But we're very intentional with data in terms of how are we improving clinical outcomes. So that's how the 50,000 is different, and the 350 is actually the users on the platform. And it started with community. I think there's a lot of value in understanding the end user, whether you sell to a public health entity or a payer, because the end user is still going to be a mom. And so we really got to understand user behavior. And then we were able to now expand into maternal care. And so that has been launched since March. And so we're really understanding what they're utilizing the most. But it's truly, initially it was personalized PT, really understanding that no, we're all not the same when we walk out of the hospital. Every labor and delivery is different. And so that drove improved outcomes. And there's several parts of the app that have had increased engagement even since we've launched in pregnancy. But hopefully that clarified the numbers. Okay, cool.